trying to say is COVID has, changed a lot of things. It has turned everything upside down, the industry, the way we work. So, COVID, has it changed the way this industry runs? Has it given new opportunities? And if yes, if there are any changes, then what are those changes, and what will be the positive aspect of it? And I think that is what Aditya is trying to ask. I'm just rephrasing it for him. Yeah.
Yeah, maybe I'll take a stab at it, and then maybe Professor Sohan Modak can add. So just if I really reflect on the last 8-9 months in the industry now, since we have had this impact of COVID, what is really happened is that it has impacted the whole world. There's no denying that, right? It has impacted logistics. It has impacted supplies. It has impacted the industry in ways that we cannot be even talking about in the time that is available for us today. It has impacted most of the biopharmaceutical companies have had to rethink very quickly. Those that are agile to address the imminent need did so by redirecting their focus on vaccines, diagnostics, that was all related to COVID. Some repurposed drugs to quickly did some clinical trials to see if there was a logical way of repurposing an existing drug for COVID. So all these different opportunities came up as a result of COVID, which didn't exist before that. And certainly that has also diverted the focus of some of these companies. And moving forward, and then the other thing that happened in the healthcare industry, a lot of the hospitals were filled with COVID patients. A lot of the hospitals were earmarked for COVID patients. With the result, what happened is some of the other diseases that are, life-threatening, that are, where we need care, were neglected. So there is actually a whole, there is a thought process now in the industry to see how has it really impacted. We're just beginning to understand the impact of COVID on some of the other healthcare sectors where cancers, premature births, and so on and so forth. People have not been able to go to hospitals because of lockdowns across the world, right? So there is going to be a need for us to reassess. And one of the things that I will say that those of you who want to be in industry, you have to be very agile. You have to be thinking about the need. You have to be addressing an important problem. Only then would you be marketable in industry. It is not dependent on what degrees you have. It is not dependent on what you have done in the past. It is about what are you going to do for the organization that you're going to join. So my friend who just spoke, Aditya, I think it's really not about the places where you worked or what you did. If you are able to address a need in the company that you are looking at, where you have unique value proposition to the company, then you will get what is owed to you. If it is not so, it would be difficult to get that. So I want everyone who is thinking about industry to think about being in this VUCA agile and VUCA world, to be agile and cope with the changing circumstances that are going to happen. If you say, I only like to work on this polymerase from this particular bacteria, you will not be able to work in industry. You may have to change your focus depending on where the need is, right? So it's a question of how do you adapt? How agile are you to cope with? But it's very critical for you to bring strong science to whatever job you want to do in industry. It is important to have that strong foundation. As Professor Modak said, you need to know how to do it, not a kit-based technology. That won't work because you'll be solving real-world problems. Okay, so over to you, Dr. Modak.
Let me give an example of what has happened due to COVID-19. One of the best technologies that has come out in the world to detect COVID-19 is in India, in IGIB in Delhi. That came out, the Feluda test came out in end of March, beginning of April, but which is the best test there is, when RT-PCR was in India was giving 30 to 40% false positive or false negatives. Now, that is the problem on one hand. You have babus who are ruling this country and who are ruling the science in this country, while the technologists who develop a good technology, they have great difficulty in getting it through. Okay. I will also explain that the company, I won't name it, which actually picked up Feluda to that also, they also sat on it. It's a very, one of the biggest, largest multinational in our country. Indian multinational. They sat on it for 3 months. They didn't know what the hell was going on because industry doesn't necessarily have either the expertise or the competence. I think they probably have the expertise, but not necessarily the competence to look at it. Because they look, money is very important. It's a dollar bill that hangs in front. That's what's count. Anyway, that aside, biotechnology, I said initially, is not a subject. So if you have taken a biotechnology subject which was started in a department of microbiology, you will get microbial biotechnology. You will first started in zoology, you will get animal biotechnology and so on. But biotechnology has nothing to do with animals, plants, and bacteria. It has to do with everything. And so choose the a particular place that you go, which has that multifarious approach to teaching of the subject and comprehension, understanding, and delivery of the subjects, which is of this, I don't call it subject, sorry, discipline, which is based on really, it's one of the most multidisciplinary area of teaching research. Anyway, that's aside the point. Now, what about the industry? The industry is not exactly the, they're not exactly the peers on the game in the say. I mean, I don't want to use my personal experience, but we tried something. We have found something extraordinary. My students have found something very extraordinary, which I will not tell you now. In case of COVID, and actually it's applicable to large number of polypeptides, a battery of about 50,000 polypeptides, that every polypeptide has an identification mark. And we try to impress on an industry, one of the representative of that industry is on this panel, and it didn't go very far, it just stopped there. But that's the reason for that is not because industry is incompetent. It's because they are looking for something different than what you have to offer. And whether the marriage is possible when the two parties when are talking to each other, are they really talking to each other on the same level and the same wavelength, or there's one is looking at left, another one is looking at right? So these are the commonality of the purpose of the proposer and the acceptor and the deliverer. These three issues are very important. And I don't know how that marriage can take place. In India, it looks like it's actually an accident. If accidentally the marriage happens, fine. Otherwise, you have had it. Feluda is an extraordinary case that is really one of the best technology ever found in this country or anywhere in the world. And very intelligent, very scrupulous, very informative, and based on really the extraordinary facts of about whether it's a COVID, whether it's reverse transcriptase, whether it is a chemical reaction, whether it's technology like electrophoresis, whatever it is. But people didn't understand. And those who understood and took upon it sat on it. Nonetheless, coming back to square one, yes, there's a great deal of opportunity in biotechnology, whether it's COVID-19 or otherwise, for startups, for original idea. All you need is you need to fight. You need that fire in your rear side to actually make it work and go through it and say that I'm going to do it. And all my students, or our students, and my students, your students are my students too, we have to give them the message, hey guys, do it. As Nike says, do it. There's no other way out, because there might be failures, 100 failures, but one success is what counts. Or there may be one success will lead to 10 and 10 to 100 and so on. I don't want to make a propaganda of this, but I want to get this message across that you have to have just tendency to keep on at it. And this is something not very much in our way of operation in our society in India, unfortunately. But it's about time we do it.
Hey, thanks for watching the video. Feel free to visit our website at www.gradskey.com. Smash the like button below, hit the subscribe button to follow. Also, to get notified when a new video is uploaded, click on the bell icon and you can get a